A lot of old faces, a lot of new faces. This is good. Thank you. Thank you for coming. My name is Joan Simon. I'm the volunteer coordinator for the San Jose Peace and Justice Center. So welcome everybody. A few things, a few housekeeping rules before we start. Just to let you know that masks are required indoors. So thank you for wearing the masks. If for any reason you need another mask, we have masks all over the place with hand sanitizers, so feel free. Bathrooms down this hall, the last door on your left. Bathrooms, okay? Also, if you can stay after the event, we are having food. So please feel free to stay after and chat. That would be great. Okay. I'd like to do a land acknowledgement.
Before you do that, please use the microphone.
Oh, absolutely. Right there. Right there. Hello. Oh, jeez. My voice projected
Please,
without
please,
this.
please.
Sorry, Greg. Okay, the San Jose Peace and Justice Center is located on the unceded tribal lands of the Ohlone, Tamian Ohlone, and Muwekma Ohlone peoples, past and present. We remember their connection to this region and honor with gratitude the land and the people who have stewarded it throughout the generations. This acknowledgement demonstrates a commitment to beginning the process of working to dismantle the ongoing legacies of settler colonialism. I'd like to thank the co-sponsors for this event: Veterans for Peace, Chapter 101, Santa Clara County Single Payer Healthcare Coalition, the Green Party of Santa Clara County, the Women's International League for Peace and Freedom, and San Jose, and the Freedom Road Socialist Organization. So now I'd like to introduce Suzanne and Steve. Suzanne Gordon is a senior policy analyst at the Veterans Healthcare Policy Institute and the author of many books. We were fortunate to have her here, plus Steve, in August of 2019 to discuss her last book, Wounds of War, where Suzanne spoke about the veterans' healthcare system. Some of us in the single-payer movement thought it may be a good idea to fight for expanding the veterans' healthcare system to everyone in this country. Steve Early is a freelance journalist, labor organizer, lawyer, and the author of, most recently, Refinery Town, Big Oil, Big Money, and the Remaking of an American City. I just would like to read two reviews on their latest book that they'll be discussing today: Our Veterans, Winners, Losers, Friends, and Enemies. As this book reveals, too many men and women in the military are exposed callously and carelessly to a toxic work environment. Their service-related problems can lead to unemployment, homelessness, and high suicide rates. That's why veterans need more real friends in Congress and the public who will better defend the life-saving programs of the Department of Veterans Affairs, VA. Our Veterans is a call to action by everyone concerned about health equity and educational opportunity for all Americans. And that was written by Michael Blecker, who is the Executive Director of Swords to Plowshares, a Vietnam veteran. Just one more review. Our Veterans tells a working class story, a labor story, and a political story. In the process, the authors have done the near impossible, written a page-turner about the Department of Veterans Affairs. They nimbly chronicle how the U.S. created a successful system of socialized medicine only to have members of Congress in recent years try to dismantle it. Our Veterans is an indictment of neoliberalism, since VA outsourcing has been a bipartisan project. While alarming in many ways, this book is also hopeful. It shows how VA-delivered care can be strengthened and improved as a model for health care for all. Written by Chris Lombardi, who's a journalist, author of I Ain't Marching Anymore, Dissenters, Deserters, and Objectors to America's War. I now give you Suzanne and Steve.
Joe. Can I get away without the mic if I project? The mic is a real...
It helps her with the filming.
With the recording.
Okay.
So take your
This might be...
mic off completely, so it looks better.
Thank you. It might be a little loud. Thank you so much for having us both down here again, and thank you, Joan, and all the other folks in the Peace and Justice Center. Great to see that you survived COVID-19. You're still running programs here and turning people out on a sunny Saturday afternoon. Joan stole the first minute of my speech, which was to thank all the sponsoring organizations. So why don't we do a little survey as a follow-up to that to find out who is actually here from those different groups. Veterans for Peace, who do we have in the audience? Okay, thank you. Huge turnout. Green Party, we have a couple of fellow Green Party voters already, some overlap there. Freedom Road, thank you for sponsoring, and the Single Payer Coalition, we've got members of that, and the International Women's Peace and Freedom Campaign. Okay, thank you so much for having us. When we were here last, Suzanne, excuse me, had just published a book called Wounds of War, which dealt extensively with the veterans healthcare system as the nation's largest public healthcare system, serving 9 million veterans. And as she argued in that book, and as Joan just mentioned, a really good model for healthcare reform, healthcare for all, for having a national health service. And this new book called Our Veterans updates the account in the previous book about the ongoing labor and community struggle to save the VA from privatization. And that situation, which many people hoped would get better under Biden, has not surprisingly. And for the last 6 or 7 years, more and more care of veterans in this country, first under the Obama administration, very extensively under President Trump, and now continuing under President Biden. Tens of billions of dollars a year are being diverted from the VA's direct care budget and poured into outsourcing, reimbursement of the same private hospital chains and for-profit medical practices, the whole profiteering healthcare industry, which is undermining traditional Medicare as part of the whole Medicare disadvantage scam, which single-payer activists in this group, in this room, I'm sure, have been campaigning against locally. So one of the things we, try to connect the dots on in the book, and Suzanne is the healthcare expert, not me, is the parallel trajectory of privatization that's undermining two major single-payer healthcare delivery system models, the VA actually being a pure form of socialized medicine, more akin to the National Health Service in Britain. You got staff members are on salary, it's mission-driven, it's integrated, it's coordinated, comprehensive, it's not an insurance system. And on a parallel track, greatly threatened is the single-payer system that covers 60 million of us over the age of 65, now at risk of being undermined and defunded and dismantled because of the incursion of Medicare Advantage plans, which the single-payer movement is doing heroic work resisting. As part of the ongoing fight involving groups like Veterans for Peace and some of the older, more conservative veterans organizations, and certainly the VA unions, the National Nurses United, the American Federation of Government Employees, there's been some victories recently, and we want to take note of those victories because we need more of them. About a year ago, the Biden administration, after President Biden ran as a candidate in 2020, promising never to defund or dismantle or privatize the VA, through his new Secretary of Veterans Affairs, Dennis McDonough, unveiled in March of last year a plan to dismantle the VA, basically, to shut scores of clinics and medical centers around the country, including one right here in Palo Alto, which serves close to 70,000 patients, 800-bed hospital. Suzanne is the expert on all the great things they do there, and she can talk more about that. Part of that complex are 3 nursing homes, a dormitory for 100 homeless vets, all kinds of other services and programs that benefit thousands of vets and their families and provide good jobs, unionized jobs for nurses and doctors and other healthcare workers. This was on the target list, the Palo Alto Medical Center. So that triggered enormous backlash, and VA patients, their families, allied with the VA unions, some of the veterans organizations, and there were protests around the country. The instrument for dismantling the VA was an Asset and Infrastructure Review Commission that President Biden had already named the appointees to. And as a result of this popular movement against his target list for facility closings, the key members of the Senate Veterans Affairs Committee refused to confirm a single Biden nominee to this commission. So it was a major victory to derail a whole presidential commission of the sort that are often appointed to do all kinds of dirty work in many different areas of public policy. That's the good news. The bad news is that resources continue to be drained from the VA, and there's continuing undermining of its capacity to do the wonderful things that it does for the 9 million people that it serves. And Suzanne can talk more about that. I just want to say that in this new book, we try to look at a broader range of issues beyond veterans health care. As Joan mentioned, we have a couple of chapters about the conditions of military service, looking at being in the military as a form of employment, a job, kind of critiquing the recruitment and training methods that are used to fill the ranks of our so-called all-volunteer force, which replaced a draft-driven armed forces nearly 50 years ago. We look at the often difficult transitions that veterans have to make from their military service to civilian life. We look critically at veterans organizations, old and new. At the progressive end of the spectrum, you've got great groups like Veterans for Peace, Common Defense, About Face. In the old guard of the Big Six, you've got a great group, Vietnam Veterans of America, aging out of existence, sadly, and some more conservative players in the field of veterans affairs, the American Legion, Veterans of Foreign Wars, AMVETS, who have not always played a constructive role in these recent struggles to fend off privatization of the VA. We also look at the role of vets in politics, very much in the news last fall. You saw some of the leading Republican candidates for Senate and governor in states like Pennsylvania and New Hampshire and Ohio. Both major parties are recruiting former military men and women to go into politics, so-called service candidates. Jon Stewart made a great satirical movie about this trend called Irresistible. Check it out. But one of the things we put out in the book is that a lot of these folks get in, and not only are they not great critics of the military-industrial complex, not big advocates of new directions in foreign policy, they don't even stick up for their fellow veterans in fights like the struggle to resist privatization. So we look at that. We look at the wooing of the vet vote. 19 million Americans served in the military. They vote disproportionately, and they are often considered by both major parties depending on what part of the country we're talking about, politics and electoral politics, kind of a key voting bloc. They get a lot of attention. And we look at the competition between Biden and Trump, two major parties, in 2020 for the vet vote, and we end the book with kind of a look at what might be a new agenda for Veterans Affairs going forward. And I have to confess that in 2020, in a safe state like California, it was very easy for me to cast a vote for the all-veteran Green Party national ticket slate of Howie Hawkins and Angela Walker. You know, most people don't associate the Green Party with running military veterans for office, but in 2020, it was an all-veteran ticket. Let me just say that by word of disclaimer, I'm not a veteran myself. I spent 1 month in the Reserve Officer Training Corps, Middlebury College, circa 1967 as a freshman. It was a draft-driven enlistment. It took me 1 semester to learn that there was a better way of getting out of being drafted than becoming an officer and being shipped off to Vietnam or any place like it. I ended up becoming very involved in the anti-war movement, the movement to kick ROTC off campus, the movement to end the draft. My first job out of college was a full-time organizer for the, working as a full-time organizer for the American Friends Service Committee in New England, and specifically in Vermont. So that was my start in activism. I spent 50 years in the labor movement, and 40 of them as a national official or rank and file member of the Communication Workers of America. So a lot of my interaction with veterans over the years has been veterans in labor. And in the 1970s, veterans from World War II, Korean War, a lot of Vietnam veterans were a key force in the struggle to clean up and reform the United Mine Workers Union. Another fellow that many of you probably know and some may have worked with, named Tony Mazzocchi, for many years, one of the most transformative and visionary figures in the American labor movement, a key fighter for passage of the Occupational Safety and Health Act in 1972, one of the initial people in the labor movement to start building a Blue-Green Alliance, bringing environmentalists together with blue-collar workers, later a founder in the 1990s of the attempt to form a third party based on unions, the Labor Party. As part of the Labor Party, a big promoter of single-payer health care and what he called free higher education for all, which he was inspired to promote because as a combat veteran of World War II, a survivor of the Battle of the Bulge, when he got back from Europe in 1945, he was one of 15 million World War II veterans whose lives were greatly improved by the fact that they had GI Bill benefits and unemployment benefits, and go to school, go to college, and learn a trade or enter a profession. So, people like that kind of taught me that there's a big overlap between labor issues and veterans issues that I think, as we argue in the book, the labor movement needs to do more to exploit in the best sense. Of the 19 million veterans, 1 million of them are working trade unionists. Very large numbers of them serving other veterans as staff members of the Veterans Health Administration. More than 100,000 veterans work as postal workers, another public entity under assault by would-be privatizers. My own union, CWA, lots of telephone workers served in the military and then became very active in the union. We have a program in CWA called the CWA Veterans for Social Change, which was started in 2020 in conjunction with Common Defense to help woo working class union members away from MAGA-land. And when you have this dual identity of being a trade unionist, but also having served in the military, it really behooves unions to start identifying who in their ranks are veterans and trying to set up special programs to kind of do political education, to develop their leadership skills, encourage them to get involved in both union campaigns and political campaigns. And CWA, I think, did a good job of that in 2020 and has tried to keep this group going as a counterweight to the, as we all know, very serious and heavy-duty and never-ending right-wing recruitment of veterans into white supremacist groups, and militia groups, and Vets for Trump, the whole array of right-wing organizations that like to tap into the frustration, the anger, the bitterness that many veterans have experienced in opportunistic ways. So I'll stop there. There's a lot that the labor movement can do. There's a lot that the single-payer movement can do to kind of link up with veterans' struggles. Anybody that's concerned about the whole problem of how we treat job-related injuries and illnesses, I think should take a close look at the VA model. For many years, one of my jobs as a union rep was helping people who've been injured on the job deal with workers' compensation systems, state-level workers' comp. And the VA is a much better workers' comp system operating on the federal level than many of our state programs. And so another reason why we have a system here that should be defended by labor, by veterans organizations, of course, by the broader healthcare reform movement, and everybody concerned about the defense of public provision, public programs, and government working for the benefit of all of us. So, Suzanne.
Thank you. Thank you so much. So I'm gonna take up where Steve left off. I do want to mention that one of the things I think that is most unique about our book is that we look, as Steve said, at military service as a job. I mean, whether people stay in for 2 years or 20 years, it's a job. And sadly, it's a job where people are trained to kill people, even if only about 10% of
sorry to stop.
are in that kind of a situation, even now with our forever wars. But one of the things that we point out, or several of the things we point out, is that military indoctrination really creates, people always talk about the civilian-military divide and veterans' difficulties in transitioning to the civilian universe. And that is created by the kind of indoctrination that the military uses to break people down so that they'll do one thing that they're taught not to do. And what is that?
Obey.
Kill people. Well, first kill people and then obey the order to kill people, right? And in the process of this kind of indoctrination, people's brains are really transformed. They're taught to hate. They're taught to think in very black and white terms. The military makes a lot about teaching people new skills and opening up people's horizons and so forth. And really now, what's really interesting about the military today is that its recruitment campaigns are not based on killing the bad guys or, jumping out of helicopters or using all this fancy equipment. The military, if you go on the web and you look at their Go Army campaign, $1 billion plus campaign to recruit, it's kind of presented as like a finishing school for working class people, right? Like, you'll get the job you want. You can be a linguist. You can be, you can work in science and technology. You're a pioneer. And when you get out of the military, you'll be able to sort of name your field. And it's really like it's an employment service, some giant headhunter. And, of course, nothing could be further from the truth for the enlisted personnel, man and woman, right? The officer class, obviously, it's quite different, and we look at the class distinctions. But, one of the things that they don't tell you is that, many of the jobs that would prepare you for the civilian sector are taken up by contractors now. And there's a huge, privatization of of our military that mirrors the privatization of the military health system in the VA. And another thing they don't so that basically when Rumsfeld and Cheney decided they wanted to have a leaner, meaner force, what they did was they contracted out a lot of things like cooks and, you know, all kinds of things that would give you a skill that you could use in when you were discharged, and reserved, you know, the jobs of knocking down doors and shooting and being shot at for this smaller force. Another thing that they don't tell people is that the military is one of the most reckless employers on earth. I mean, they don't just, you know, wreck other countries, but the Vietnam vets know this very well. You know, the exposures to toxics like Agent Orange, the punishing exercise regimens that leave people who are very young with chronic musculoskeletal disease problems. Now we have the burn pits in Afghanistan and Iraq, right, where you have 3.5 million people who were exposed to all kinds of crap that's unimaginable. I mean, this was, you know, it's one of the things we criticize is this idea that you look at military service as service and sacrifice. And so, you know, that sort of justifies that you're prepared to die in combat. But as we said, very few people ever go into combat, and they use that to justify all kind of preventable problems that the military could prevent. I mean, obviously we can prevent these elective wars, but even, you know, even the kinds of issues that people suffer from, military sexual trauma, right? 1 in 4 female active duty service members suffers some form of MST, whether it's harassment or outright assault and rape or murder. PTSD that comes from training, brutal training regimens. You don't have to leave the continental United States to get PTSD from the military, right? 126 bases are in America are contaminated with all kinds of horrible chemicals, etc. And so that's something that we focus on in the book, and you know, that I think is very relevant for people in the peace and justice movement or fighting for social justice, because these are preventable problems that the military could prevent, and we go into all of them. And of course, one of the biggest problems that we can prevent, is, as Steve mentioned, is the privatization of the VA. And I want to give you a kind of a little quiz, and I do this everywhere, and I know I've spoken about the VA here before, but I'm not sure people have heard me. And I'm going to give a free Our Veterans book to anybody who can answer one of these 5 questions, right? And sadly, I do this almost everywhere I speak, and I almost never give away books, so I hope you'll break my record, right? So I guess my first question is, you know, why should healthcare reform activists or peace and justice activists care about the privatization of the VA? Why should you care about it?
Well, it's going to affect Medicare.
Right, there you go.
Okay, no, that's
You
good.
got to care for the military and care for yourself.
Right. Okay, that's a really good answer. I'm looking for a different answer, but
Oh, darn.
okay. What else? Why should we fight for the VA?
Because if politicians throw vets under the bus, they'll be able to throw anyone.
Okay, that's a very good point, but I was looking for.
Where will they go?
Yeah.
Is it because the VA is the nearest form of universal health care that we have here?
That's another good one. But okay, the answer I'm looking for, and there's really no reason why is because the Veterans Health Administration actually serves all of us, not just veterans, right? It is actually our healthcare system, right? It's the only healthcare system in the country that actually serves all of us. And this leads to my second question. So when you're defending the VA, you're not just defending a healthcare system that serves vets, although that's a very important reason, because no matter what we think of these wars, right? No matter what we think of them, whether, obviously everybody in this room doesn't think much of them, you know, people have signed up, right, or been conscripted in the past, but people have signed up to serve their nation, and they, good or ill, think they're serving it, and they think they're serving us, and so we owe it to them. That's clear. But this is a healthcare system that serves us, and this is going to lead into my second question. Okay, so how many people in this room know that the VA healthcare system is the hub of the healthcare professional education system for the doctors, nurses, physical therapists, so forth, that, you know, treat us all, right, that take care of us all? Somebody know?
I used to work for the VA.
Okay.
I know that.
All right, I'm not sure. Okay, so that's question number 2. How many of you know, does anybody in this room have a shingles vaccine?
Yeah.
Okay. Do you know to thank the VA for your shingles vaccine?
Yes.
How many of the, is anybody in this room have an implantable cardiac pacemaker or know somebody that does? Okay, how many of you know that thanks you for the VA for that? The nicotine patch, anybody ever used the nicotine patch or known anybody who's used the nicotine? Thank you, VA. You know, the VA is the biggest research powerhouse in the nation after the National Institutes of Health. And this is why I say it's the only healthcare system in the country that serves us all. A lot of people in this room have prostates. I'm not going to ask if any of the people with prostates have ever had prostate cancer or know anybody who has had prostate cancer, but the American Prostate Foundation, or Prostate Cancer Foundation of America, or whatever it's called, they gave the VA, you know, $50-60 million in grants and have an ongoing research project with them. Why? Because the VA is the only healthcare system in the nation that has like a whole lot of prostates, right? A lot of them, right? From discharge to grave, a population of prostates that can be researched to answer all kinds of vexing questions about prostate cancer, like how come African American men who get the same treatment for prostate cancer, it's more lethal for, etc. So that, you know, and all of this research, none of it is proprietary, it's all public. They publish about 10,000 research studies a year. I mean, it's a huge research powerhouse. And then finally, has anybody ever here in this room heard of the VA's 4th mission? Okay, so, and you worked for the VA.
I should have. I
Okay.
heard you say that.
That's right. So essentially, one of the VA's missions, it's got 4 missions, you know, clinical care to vets, teaching, research, and its 4th mission is to serve as a backup for the American healthcare system in times of local, regional, and national emergency. So during COVID, Palo Alto, San Francisco, all of them kind of set aside beds in their ICUs. Every single hospital in the nation set aside beds in their ICUs for hospitals overwhelmed with COVID patients in the civilian sector. So, you know, I could be in Palo Alto. It didn't happen that way on the West Coast. But in New York and New Jersey and Louisiana and all the hot spots, civilian patients came into the VA and were cared for. They took over nursing homes in all kinds of states. The VA took them over. They have telehealth ICUs. They have, so this is why I say that you know, it's a system that serves us all, and I think that's really important for us to know, because unless Americans understand that the largest healthcare system in the country, which the VHA is, serves us, then it it's just charity for a declining portion of the American population. And then the VA is going to get what you give the beggar on the street, which is a buck here, a buck there. But it is our healthcare system. I mean, we have a stake in it, and it's not just for vets, right? Which I think is something I never knew, right? I mean, as a healthcare researcher and writer, before I started writing about the VA, 15, 20 years ago, I would read things in the paper about innovations in care for in the VA, and I would think, well, I'm going to skip. I think I'll skip that one because I'm not a veteran. How is that going to help me? And now I realize that it can. And of course, the way it's going to help everybody in this room is if it's a model for a socialized healthcare system. And I think more, personally, I think the slogan should be VA for all rather than Medicare for all, because the VA is a system and a payer. And, you can make changes in how you deliver care. And increasingly, as the American healthcare system gets taken over by corporate entities and private equity, I wonder about Medicare for all, because by the time we get it, if we ever get it, I mean, it will be completely overtaken by corporate and private equity interests, and then are you going to want to feed people into that? And there's already a robust discussion taking place in the single-payer movement about should we be asking for Medicare for all, or should we be asking for a national health system? So these are just some of the issues that we take up. Obviously, we hope folks will read our book, but more, we hope that it will launch a discussion about how our country should look. Should only vets get the GI Bill? And free education, or should everybody, like Tony Mazzocchi wanted? Should only vets get, free health care? Well, now it's, even that, and trying to take that away. Because, one of the things that's going to happen is as the privatization of VA healthcare increases and they send more and more people out to the private sector, it's going to become more and more expensive, and what's going to end up happening is Congress is going to say, we can't afford this, so they're going to, whittle away which veterans deserve it, right? And there's always already a discussion of that among right-wing vets who say, they shouldn't give it to everybody. They should only give it to people, who have, triple amputations or something like that, and PTSD, there's no such thing as PTSD. These people are faking it. They're just having a bad day. I mean, it's pretty extraordinary what some of these veterans, these right-wing vets are saying. So we hope that we can have a lively discussion about these and more issues, and we really thank you for coming and for all the work that you're doing for the nation. Thank you for your service.
My first question, just to start, is when you say that the VA is for everyone, as a civilian, my assumption is that I cannot, in usual circumstances, I can't go to the VA for healthcare. So the perception would be that, in typical situations, the VA would only be open to veterans.
Absolutely. I'm sorry. So what I'm saying is, what I said was the VA is the only healthcare system in the country that actually serves the country. And so, yes, absolutely. You cannot, unless it's a fourth mission issue where there's an emergency, like if you were living in Puerto Rico in Hurricane Maria, and all the hospitals in Puerto Rico were knocked out, and the only one left standing was the VA hospital, you could go to the VA hospital in Puerto Rico. If you had COVID and you couldn't get into a hospital around here because they were overwhelmed, you could go to the VA in Palo Alto. But no, you cannot go to the VA. Actually, it's pretty interesting because under fourth mission, they are beginning to look at ways to open some hospitals up, like in White River Junction in Vermont, where there's a mental health crisis. They're letting some folks who can't find mental health care go to the VA and get mental health care there. So we could expand the VA under the fourth mission you know, you could make arguments that if there's a crisis in rural America or wherever, but I didn't exactly misstate it, but I think you're absolutely right. And our argument, at Veterans Healthcare Policy Institute and in this book, is that the VA should become, you know, in places where VAs are underutilized, they should never be closed, and they should be opened up to communities where there are shortages of mental health providers, primary care providers, which is pretty much all of America, you know. And you had more questions, I know, so.
But I would just say that we argue in the book that to be politically realistic, you know, you want to start by expanding the population of veterans or their family members who have access to the VA. You've got 19 million veterans, only 9 million qualify for VA care at the moment. 2/3 of those have been able to prove a service-connected disability, a medical condition that gets them a disability rating and some money and gets them health care. The other third or so, it's means tested. You know, if you're low income, you know, like you qualify for Medicaid based on low income in many states, all states, you can get into the VA that way too. So Bernie Sanders, for example, has proposed lowering the income levels to make more veterans who are poor and struggling, and many times on limited incomes over the age of 65, eligible through more liberal means testing, even if they don't have a service-related condition. Swords to plowshares, which we mentioned earlier, you know, has filed a rulemaking petition for years with the VA to try to get them to open the doors to more veterans, hundreds of thousands of whom have been disqualified from access to VA healthcare because of their other than honorable discharges. And many of those discharges were punitive. It was the military getting rid of people who caused them trouble, getting rid of people that had been damaged by the military, and then once they developed PTSD or had experienced military sexual trauma or become a substance abuser, were flushed out and penalized in the process by being denied access, in some cases, to GI Bill benefits, but certainly to health care if they had the wrong kind of bad paper, as it's called. So if you started, you know, incrementally expanding the patient population to veterans who need the VA and are currently not served by it due to congressional restrictions on access, I think that would be a first step. And, you know, including VA employees themselves as part of the patient population, certain family members. I mean, there's a lot of different directions you can go. It's not going to be any overnight transformation, but some of these incremental expansions of coverage are really important in terms of making the case, as Suzanne said, for keeping facilities open in places where if they just do a head count based on today, oh, why do we need this hospital? Well, I'll tell you why. You just passed the PACT Act last year, allocating $280 billion over the next 10 years to hundreds of thousands of people who are going to be filing new disability claims based on burn pit exposure. And if you're offering them greater access by creating presumptions that will help them get VA coverage, well, who's going to be there to care for them if you've got a facility closing plan of the sort that Biden was ready to roll out and implement last year? So let's hear from some other folks. Yes?
Do you have a question?
Yeah. So I have a comment and a question. It's mostly directed for Suzanne. Personally, I feel that the military does not serve us, that the wars do not serve us. So I think veterans should be cared for not because of service, but because they're human beings. And every human being deserves to be taken care of no matter what they've done. So that's my comment about that. So you said that the VA has all kinds of research capabilities, and I was wondering if some of these new prosthetics that we're seeing, if the VA has done some of that work for the new prosthetics.
Yeah, the VA has really state-of-the-art prosthetic research. I mean, it's extraordinary, the kind of stuff they've done. And again, that benefits everybody, but it certainly benefits vets. And I mean, it's very interesting because what the VA considers to be prosthetics is not just, you know, legs for people who had their legs amputated or whatever, but any device like they consider an iPad to be prosthetics, right, or an iPhone. So, for example, if people have telehealth or virtual appointments, they can get an iPad or a laptop or a device free from the VA so that they can access that. So, you know, the good news is we have telehealth, right? The bad news is if you can't afford to buy a device, you're kind of out of luck, right? I mean, the broadband issue is something that they can't solve on their own, right? Giving broadband to people, and 25% of veterans live in rural or highly rural places. But I mean, in Wounds of War, I described the kind of prosthetics that they give. But yes, the answer is that they do an amazing prosthetic research. I mean, the research that they conduct is pretty extraordinary in the VA, and like, you know, tragically nobody knows about it. And one of the things that's interesting is, you know, Biden's secretary is all for like competition, healthy competition between the VA and the private sector, but they won't let the VA advertise. It's you know, they give them such a little budget on advertising that there's buses that go from like Palo Alto VA, San Francisco VA to downtown, and it'll say San Francisco VA healthcare system, but they won't let them say, you know, the best ER care and whatever. And they're not allowed to offer competitive salaries. In areas where they offer, there are some locality adjustments in areas where they offer competitive salaries, they're never allowed to beat the competition. So, you know, if you really want the VA to compete, which I don't, I mean, I don't believe in all that competition nonsense, but if you really want the VA to compete, then you have to let them, you know, beat you in a salary competition or advertise like other healthcare systems do. And whereas many of these healthcare systems, really, it's all fake advertising or fake facts. With the VA, it's real.
So yeah, one reason I really appreciate the VA is that it is like mission-oriented healthcare. That is so important because, and it's sort of why VA does such a good job in things like mental health and helping people get over like substance abuse and things like that. It's sort of famous for that, and so we, you know, and it's sort of, that's why it's also a model for what we want nationwide, right? That we want healthcare to be mission-oriented, period. It's not instead of profit-oriented, right? And so, and if that's also the reason that it's under attack, and they're trying to wreck both any system, like the VA or Medicare or anything like that. So it's just more of a comment, but I just really say that we really need to know about. Like, I didn't know about the Palo Alto VA being like targeted like that. I don't know if because I know we have had, you know, did we do a demonstration out there or have our banner out there at least? We never did that. Okay, I know we talked about it. Anyway, I mean, but I didn't know that that there was anybody. Was anybody out there, you know, at the Palo Alto?
I mean, it really depended on, I think, the unions in the area taking the initiative. I mean, the workforce, the VHA, as you know, the largest group of workers are represented by the American Federation of Government Employees, but National Nurses United, the CNA, big single payer ally, represents about 20,000 VA nurses scattered around the country in some medical centers. And then a couple of other unions, NAGE, SEIU, and the Federation of Federal Employees. So it's a somewhat fragmented bargaining situation, but a heavily unionized healthcare system. And where the biggest protests, like New York, I mean, they were threatening to shut the Manhattan VA Medical Center, VA Medical Center in Brooklyn. So it was really a wake-up call to unions, their allies, patients, providers, their families. And where people came together, they raised a huge ruckus, put a lot of pressure on members of the House and the Senate. And it's very rare for a presidential commission to be tanked, right? When he's got a whole, blue ribbon panel already nominated by the White House. They thought it was going to be rubber stamped. And of course, it was packed with privatizers. People who were ready to rubber stamp McDonough's facility closing restructuring plan. So derailing that, was a very, very important defensive victory. So, other people we haven't heard from on other issues. Joan.
Did you compare the VA healthcare system with the NHS in England?
Well, I'm sorry, your name is? Greg. Greg talked about, why the VA is mission driven, but it's mission driven. It's got a global budget. It's like the NHS. It owns the hospitals, it owns the equipment, the workers are all on salary, which is extremely important because if you're on salary, you have less of incentive to do things that are unnecessary, and you have less incentive to, let me give you an example. In the VA, if you're an elderly gentleman who's having benign prostatic hypertrophy, right, which is a irritating and chronic but very manageable condition without surgery, well, in the private sector, urologists, if you have BPH, you can call a urologist and they'll give you an appointment in 5 months because they're reserving all their appointments for patients with surgery because that's more lucrative in a fee-for-service system. So you could have BPH and call your doctor and okay, it'll be 5 months. In the VA, they'll see you in 2 weeks because you're on salary, so it doesn't. If you do surgery, you don't do surgery. This was why they could shift staff during COVID. They could tell, orthopods who weren't doing knee replacements anymore, to do COVID tests because they're on salary. They could tell them to go to New York because they're on salary. There was an article in Times the other day about the dilemma that these docs are having with telemedicine and email because they're all having to respond to emails, and how do you bill for emails? So they want to start billing us like $30 for answering an email. Well, I sympathize with them in a fee-for-service environment, but that would never happen in the VA, right? So it's very much like, it is exactly like the NHS. And actually, Joan, the same people who are trying to privatize the NHS are trying to privatize the VA. Same exact people. Bob.
Yeah, sort of a follow-on. Has there ever been any effort to I agree, the VA is like a mini NHS for the US. So has there been any effort to expand, say, take postal workers, take government workers, because it seems like that'd be a natural way to try to get healthcare.
Well, I think that what Steve outlined is the best, the best strategy is start with, the 11 million vets, or it's probably 9 million. Right now there's 9 million vets who are enrolled. There's probably 11 million who could enroll. And vets are very confused about the VA. They're very, they've made the eligibility requirements so confusing. And then some people think, oh, it's only available to combat vets. And women veterans think, oh, I'm not really a veteran. And, actually there's a bill in Congress that passed the House but hasn't passed the Senate called the eVest bill. Because right now, when you leave the service, you have to opt in to enroll in the VA right, not opt out. And so if they would just enroll everybody in the VA when they left the service, right, you would have more veterans have the VA on their radar, and the VA would have them on their radar. You'd still have these stupid eligibility requirements, but I think that Steve is correct, that, you know, the best way to do this is all vets, you serve your country for a day, you know, 20 years, 2 days, whatever, you get into the VA, no matter whether you hurt yourself or not, or you have a low income. Then you add their families, then you add VA caregivers, and then you can add communities, you can add, you know, postal workers, whatever. But I mean, I think the best way to start, and actually the American Legion proposed in 1996, they proposed that the VA should be kind of like an HMO for family members and non-eligible veterans, and that they could pay, you know, and I mean, and the other veterans groups, this was the Legion, the American Legion, had a hissy fit and said, oh my God, some veteran's wife could get in, you know, in line before a disabled veteran, and obviously, you know, if you had a bigger population, you'd hire more staff and you wouldn't have to have that happen. So I favor the, you know, but I think in areas where, like rural areas, you could argue for the VA serving the community in rural areas, particularly if there's a declining population of veterans. Steve, did you want to? I also want to mention that another thing that nobody knows about is that the VA secretary has done one good thing that I like, and that is he has opened the VA to female veterans for abortions in rape, incest, or the health of the mother in states where they can't get abortions because of these bans. And that's one of the things that the right wing in the House it wants to attack. And we argue that, you know, there had been an argument that you could expand the provision of abortions to any veteran who wants it, and you could also probably make the argument under Fourth Mission that women who've had miscarriages and aren't getting good standard of care could go to the VA because they can't get health care in those places. But nobody knows about the VA as an abortion provider. Anyone else?
So I think I have a kind of a follow-up question, and I want to kind of ask it specifically about what you've been bringing up in relation to privatization of the VA, because it seems like that's kind of the gist or the thrust, one of the main themes of your new book. So I remember sometime when President Trump was still in the White House, that he seemed to have one time where he said that he thought that, you know, the VA was kind of, you know, making vets wait too long to be seen. And so he, whatever, you know, you think about President Trump for or against him, but I remember him saying that something that he tried to do, and maybe he was able to accomplish it, take action. He said that either he was going to make it so that the waiting period for vets to get a typical appointment wouldn't be as long, or what he said was better was that they could see any, you know, clinician or physician outside of the VA, and then that would somehow be in lieu of that, but it would save a lot of time, and he thought that that was a very positive thing. I think your claim in your book is that that would privatize, essentially, but also maybe, whether you agree with this or not, my perception is that if the VA, you know, outsourced, like you say in your book, then that would be decentralized, and it would be harder to kind of centralize. It would be harder to maintain standards or quality control,
Right.
Because let's be honest, when you go outside a big institution like the VA, you're essentially in private practice. And private practice means that only, you know, the person whose office you're in really knows whether they're meeting, you know, whatever standard it is.
Good question.
Yeah, I mean, the quick and simple answer is that there's been a couple of pieces of legislation that have opened the doors to this draining of resources and this unnecessary referral of hundreds of thousands of VA patients outside the VA. And the first was the Choice Act, as it was called, of 2014, which was a response to a localized problem in one VA medical center. And the idea was, all right, we'll have a 3-year experiment. This was under Obama, where we're going to refer more people out, if they are waiting too long for in-house appointments. And that was replaced by Trump's legislation, which you referenced, the VA Mission Act of 2018, which was followed by some access standards, some rulemaking procedures undertaken by the VA that really just opened up the floodgates of outsourcing. The VA, prior to 2014, if there was a service or medical procedure or something that a vet needed, they would be sent outside the system based on medical need, based on their doctor's recommendation. So people were never captives of this system. The problem is that after 7 years of this experiment, you have a national healthcare system that we've all been discussing here, got a budget of a bit more than $100 billion a year. Close to a third of that is now going to reimbursement of outside providers. So I think about that. You've got a direct care budget, the largest public healthcare system in the country, $100 billion, $110 billion. If you take 35% of that, and you just function as a Medicare-style reimburser of whoever submits bills to you for the treatment of veterans who've been sent out unnecessarily, how long is that system going to remain intact? How many people here are in Kaiser? Okay, so you're all familiar with how, being in network versus out of network and how managed care works. If you go to Kaiser, does Kaiser say to you, oh, we're going to offer you patient choice. We're going to let you basically self-refer yourself to Sutter or to the Stanford Medical System or to UCSF. Anytime you think you can get in to any specialist, yeah, quicker, right? And we'll let you do that. How long would Kaiser and its network of clinics and hospitals and its thousands of doctors and nurses remain intact as a functioning healthcare system with a third of its budget going to reimbursement of its competitors? So this is the crazy situation that's been set up, and it's not sustainable. McDonough has now projected that half of the VA's clinical care budget will be diverted to outside care unless he reverses, which he has refused to do so far, the Trump access standards, as they're called, the ground rules for referring patients outside. And he could do that administratively, doesn't have to go back to Congress and get the Mission Act amended. And the problem is the Medicare Advantage problem. Once you have the same healthcare industry profiteers, United Healthcare is a big one, poaching patients, from traditional Medicare to getting them into their Medicare Advantage plan. Same outfit, it's become a big outsourcer of veterans healthcare. And once you've got a 35, now 40, soon to be $50 billion a year pot of money that the private healthcare industry, a trough that they can stick their snouts in, you've got a huge lobbying force in Washington to maintain the status quo and in fact to make this incremental privatization situation even worse. But it's reaching the crisis point because you can't maintain the infrastructure of a direct care system with that amount of money going out the door unnecessarily. No private healthcare system could survive long with the same inside-outside referral rules.
And also, what's really amazing, and this has been in study after study, is that the whole excuse behind the Mission Act and the Choice Program was that you could see providers in the community, in the private sector. They call it community care. This is like a right, it's like pro-choice, pro-life, all this crap. As though the VA weren't part of the community. So I refuse to call it the Veterans Community Care Program. It should be called the Veterans Corporate Care Program or the the private sector program. But they have shown in study after study that the wait times at the VA are, particularly if it's well-staffed, which they refuse to do, are way shorter than in the private sector. I mean, what happens is the Wilkie standards were, the Mission Act said that veterans should be allowed to go to the private sector for medical necessity, but they also gave the secretary wide latitude to make different criteria for eligibility to private sector care. And what Wilkie did was he established a standard that's, if you want a primary or mental health care appointment and you have to wait more than 20 days or drive more than 30 minutes, right, and that you can go to private sector. And if you have a specialist appointment and you have to wait 28 days or drive more than 60 minutes, well, it can take me like half an hour to go from Berkeley to Oakland sometimes, right? It can take an hour to go into San Francisco. And so that guarantees that veterans, this flood of outsourcing. McDonough can change that. But the ridiculous thing is, Doug can be offered an appointment at the VA in 25 days for mental health, and nobody tells Doug that if he waits that extra 5 days, he can get in, but that he's going to have to wait 5 months in the private sector. Because the wait times are way longer in the private sector, and the quality of care in the VA, study after study has shown. I'm gonna just give you one example. They did a study of 400,000 veterans who had Medicare and VA eligibility. It was like 500,000 ambulance rides. Ambulance took them in a medical emergency to the VA or private sector hospital. If the veteran was seen in a private sector hospital for an emergency, he was twice as likely to die in 28 days than he was if he was seen at the VA, because the lack of follow-up and continuity of care and coordinated care. And the researchers who were not, who were connected to Stanford, economists connected to Stanford, call that the VA advantage. And, so the quality of care in the private sector is fragmented and not as the wait times are longer, and the Democrats all voted for privatization and continue to, with a few exceptions, continue to vote for privatization. So one of the things folks can do here is if they're, if they're calling a congressperson or a senator about anything like a single payer bill or anything, they can say, open the VA up, make the secretary change the access standards. Jackie Spear, Ro Khanna, Nancy Pelosi's pretty good on this, but these people have to be expanding, what they're not on the committees, on the Veterans Affairs committees, but they can call the secretary, they can put pressure on the VA leadership.
As a follow-up to that whole issue is that wasn't also right at the beginning there when they were talking about the scandalous, where people were, like veterans couldn't get into the system, there was, they weren't getting responses, and wasn't it like, another issue is just, if they just hired some people in these places to helping people, facilitate people getting into the system, they could have solved that. And also, expanding the services within the VA, isn't that probably a lot less expensive than what we're doing, what they're doing now?
Definitely, and Suzanne mentioned this fellow Robert Wilkie, who was Trump's second VA secretary, who was in there for 2.5, 3 years. He's a Republican political operative, right-wing ideologue, committed privatizer. And at one point during his term, there were as many as 50,000 vacancies, VHA caregiver vacancies. And he made it quite clear when pressed on this by members of Congress, it's not my priority. His priority was outsourcing. and giving veterans this illusory choice, and not telling them that the first choice of most of them is going to be undermined, destroyed, and dismantled. And you'll end up with only one choice, and that's private care. And that's long been the Republican agenda. I mean, John McCain, Mitt Romney, 15 years ago, floated the idea of turning the whole VA into a voucher system, right? We would just take the whole budget and, give people vouchers to go out to the private healthcare system, shop around, endless choices, and dismantle the public healthcare system. Now, they couldn't get away with that. They couldn't overcome the opposition of even the more conservative veterans groups. So the stealth strategy is incremental privatization. You cover it up with the rhetoric of choice, community care, and then you discredit the VA by disabling it. You've got 50,000 vacancies. Hey, yeah, you will have some appointment delays. And, people, good doctors and nurses and therapists and support staff, aren't able to apply and get jobs. You're hollowing out the system, and it becomes a fait accompli. So, but that was part of their conscious strategy. You would hope that the Democrats getting in would fulfill their campaign promises in 2020 to rebuild, to go in a different direction, but just like with the Medicare Advantage stuff, they're on the same track and they have not reversed course. And that's why I think these are critical fights on both fronts.
Well, and I think that, to the extent that anybody knows veterans, and of course fewer and fewer of us know veterans because, they're with the all-volunteer army, I mean, there are fewer of them and they're more geographic. Well, there's obviously veterans here, but this is unusual, I think. But I think that one of the things that I realize is that one of the biggest, impacts on whether vets use the VA is other vets talking to them. Other vets saying, you need help, right? Because there's this suck it up mentality that particularly, well, all vets get, but young vets, particularly. And, I know a lot of Vietnam vets who don't use the VA, and I, always say to my friends who are veterans, you're nuts if you don't enroll, because you don't have to go there necessarily, but you're going to get much better care, and there may be times when you'll need it, particularly as you're older. And I think people should use it. And it's incredible the ideas that veterans have about the VA. Like there's some veterans who, I ended up doing radio shows about this book, talking to veterans who are the host. I talked to this one woman and she was like, oh, I don't want to go to the VA because I don't need it that much and I don't want to take money away from somebody who does. Well, the VA budget is based on utilization. So you're actually taking money away from it if you don't use it, right? Then if you use it, so veterans speaking to veterans can have a huge impact. Or anybody speaking to veterans and knowing about the VA, if you know a veteran, and I talked to this young former Marine, who had all kinds of chronic pain problems. And he's like, oh, I don't want to go to the VA because all they do is they give you pills, and actually sometimes a pill is good, but okay. But, I had to say to him, actually they have acupuncture and meditation and yoga and all kinds of, they're very against opioids now. And so I think that, to the extent that anybody can reach veterans to get them to utilize the VA, that's really important. That's a big thing to do. Probably we should, unless anybody has any other question, we'd be glad to, chat with folks informally afterwards, but.
Well, did you bring books?
Yeah, they're in the table in the back, and we even have a way you can pay by credit card, but I'm sorry
Who won that trick quiz? Did anybody get a free book? I think that was
somebody should get a free book. I think you. Get something. I think you a free book.
All right.
And you get to choose Wounds of War or
Well, I'm gonna buy your latest, so give me the oldest one.
All right. Thank you.
That's great. Yeah, okay.
Nice.
So thank you
very
so
much for
much.
having us.
Thank you so much. if you all would do is, I co-founded and serve on something called the Veterans Healthcare Policy Institute, veteranspolicy.org. And if you're interested in these issues, and it would really help us too, if you would just subscribe to our newsletter. And please noodle around the website. We have if you're interested in following the privatization, the studies that show what the VA does, so veteranspolicy.org. And you know, we won't send you a weekly or daily, you know,
Silver too, you should mention.
Oh, and please forgive me. I'm so sorry. The only veterans group in America, really, that has been fighting privatization with any vigor, really, and consistency, and has had a huge impact is the Veterans for Peace Save Our VA campaign, and I'm honored to sit on their steering committee. So veterans in the room, or anybody, can join that. And to find out more about the Veterans for Peace SOA campaign, you just have to go to the Veterans for Peace website, or just hit, I think they have their own, you know, link, SOVA, Save Our VA. And it's, you know, just a tiny group of amazing veterans. And we need more folks to take part in that. So thank you for reminding us.